online ads. And then some reliable sources include getting information from health and medical professionals because obviously they're trained to give proper advice and information, government agencies, and health organizations. Okay, so some trustworthy websites include government websites such as the CDC and the National Institutes of Health. University or med school websites, they're secure if they have like .edu or .org, which indicates that these are reliable sources. And you also want to ask yourself, like, what's the purpose of the website and who owns or sponsors it? Who wrote the information on the website? Who reviewed the website? When was the website written and or updated? And is your privacy protected? And if most of these answers are yes, or like something, a website that's written recently, that's been updated recently and written by proper medical professionals, then that indicates that it's probably trustworthy.
Okay, so we're just gonna go through a quick little quiz on some common health terms. So the first health term is BMI. So does anyone have any idea what BMI could stand for? Yeah, Hannah. Yeah. Oh, and someone in the chat said body mass index. That's correct. BMI stands for body mass index, which is a way for doctors or health professionals to kind of quantify your weight compared to your height. And just as a quick note, if anybody's annotating on the screen, could they please delete those annotations or just stop annotating? Okay, our next health term is going to be PCP. So does anyone have any idea what PCP could stand for? Okay, PCP stands for, yep, someone in the chat got it again. It's a primary care professional, or in this case, primary care physician. This is someone that you go to for most of your general health concerns. And there's lots of PCPs in our area that can take care of kind of like how children go to a pediatrician, adults go to a PCP, which takes care of most of their general health concerns, not like a specialist. So our last quick quiz term is CPR. Does anyone know what CPR stands for? Yep, someone in the chat got it again. It's cardiopulmonary resuscitation. So CPR is a practice used when someone's heart stops, and it can consist of things like chest compressions and forcibly blowing air into the recipient's lungs in order to restart their hearts. And it's a life-saving practice and something everyone should learn. So CPR is definitely an important part of health literacy because it could save someone's life one day.
Good. So to help make informed health decisions, follow the three steps of researching, asking, and thinking. So first, you want to make sure you look up reliable information from trusted sources, which can be medical organizations and government agencies like CDC or NIH. And then you want to make sure you ask and discuss your concerns with a trusted source. This could be your primary care physician. And then you want to make sure you consider the pros and cons, and you can do this by making a chart.
So another really important aspect of health literacy is establishing good understanding between doctors and patients. This is important because it could increase the likelihood that patients will understand and follow their treatment plans correctly. And it can also increase a patient's satisfaction with their medical experience, which could encourage them to return again if they feel that it's necessary. It can also help a patient feel more valued and respected, which could encourage more open communication between a patient and doctor, which is important because a patient might feel more encouraged to share more about their family history or genetic history or anything else that would be relevant. So in this picture, we have some examples of kind of complex medical terms like cardiovascular, hypertension, arthritis. So, does anyone have any ideas of how we can say these words in more plain language? Yep, dermatology is skin related. Hypertension would be high blood pressure. So some examples would be for annually, you could say yearly or every year. Arthritis is joint pain, cardiovascular is having to do with the heart. A dermatologist is a skin doctor, like someone said. Diabetes is elevated sugar, hypertension would be high blood pressure.
Okay, so building off of what we learned throughout the webinar, I'm gonna list a few scenarios, and either in the chat or like raising your hand, you can answer like what you would do in this situation. So our first scenario is you have been on a medication to treat a chronic illness. However, recently the pain has subsided and you wonder if you should continue taking the medicine. What would you do? Yeah, a few people said in chat to consult with your PCP or your doctor because they would know best on what to do based on your situation. Looking online wouldn't really help because like they don't know your exact situation as well as your doctor. So that would definitely be the best answer. Our second scenario is your friend has been telling you about a new dietary supplement they've been taking that boosts their energy and their mood. When you research the supplement, however, there are some people praising it while others point out the side effects. How could you test the reliability of the information you found? Yeah, again, you guys are saying PCP, which is a good way to check the reliability of the dietary supplement. But in this case, another thing you could check is one of the trusted websites that have been mentioned, like NIH or Mayo Clinic, because they would have like research done on this on the supplement. Um, our final scenario is when you turn 40, your doctor recommends that you take a disease screening for an illness common in people in their middle ages. Despite the benefits, the test is not always accurate and may lead to unnecessary stress. How would you weigh the benefits and drawbacks of the screening? Yeah, talking to your doctor is definitely the best option in this scenario because they can tell you the possible benefits and like how useful it is to find an early detect the disease. Another thing you can possibly do is consult and like look back on your family and personal history regarding health, so you know like if this is worth checking and risking the unnecessary stress.
Okay, so before we move on to our activity, does anyone have any questions related to anything that was discussed in the webinar? You can feel free to raise your hand or just type it in the chat. Okay, because I think there's no questions in the chat, we're gonna move on to our activity. So we're just gonna do a quick Kahoot. If you guys want to get up and get a second device or something, feel free to do that. We're gonna just start it in 2 minutes, so you guys can go grab a device if needed.
Is anyone having any difficulties or else I'll start it now? Okay, if that's everyone, we're gonna start it now, but I'm pretty sure you can join in the middle of the game too. By the way, this answer is actually 6%, not 60%. That's our mistake. Sorry. So congratulations to our winners. I hope you guys had fun playing that game.
Okay, so we are pretty much done with our entire webinar, but just to make sure that you guys get your volunteer hour, I just posted a form in the chat. You just have to fill that Google form out. It's just a quick reflection so that we can just have you in our system so that we can give you your hours. And once you're done filling out that form, feel free to leave. And if you guys want to see the slides for this webinar or the recording, it's going to be posted on our YouTube channel and our website shortly. So I'll just link both of those in the chat as well.